I am Dr. Muhyuddin Ahmed. I'm a clinical psychologist, retired now, and I'm in mid 80s, but I'm still active in mental health and psychology related publications. I'm going to talk with you about body movement awareness, an exercise to promote personal well-being. This exercise is actually a part of mind stimulation therapy, a clinical model that I formalized in collaboration with Professor Charles Bouvet through our writings in books and articles. And you can visit www.psychologymentalhealth.com and go down the list of publications where you will find many references of what I'm going to be talking with you today. The body movement awareness exercise can be viewed as affirming to us that we are still alive in this world, a feeling that we often take for granted. The exercise, we believe, has positive benefits in promoting an existential and spiritual perspective that we often rely on in our daily coping with everyday life issues. People who are wheelchair bound or even bedridden due to their physical disabilities, they can also do some of these exercises, including breathing or or following one's movement of the arm that goes as it goes up and down, again to promote maximal awareness of movement within oneself and concentration. And at the same time, by doing these exercises, one may feel, hey, I'm still alive in this world. I can move. No matter how disabled I am, I can see how my arms, how my hands are moving, how I'm able to hold the grip or practice gripping, or even more restricted people with more restricted movements that I have worked with people, some people in nursing home, you can even squeeze the bed rails or the wheelchair. See what I'm doing? Putting pressure. So the idea is that there's a movement, awareness of the movement, and you can do the same thing with your leg, moving your leg going up and down, or even the knees like this. So these are some of the exercises for people with disabilities. These body movement awareness exercises that I demonstrated in ways reinforce practice of our basic mental skills such as concentration, attention, following specific goals and rules in a situation, preparatory readiness for anticipation of movement and changes that may happen, as well as goal attainment, such as anything that we do, we have a we have a sense of what we are going to accomplish, and then we have a sense of how, after evaluating how best we can accomplish, we decide on a course of action. Those are the steps, and in this case, the steps are counting of numbers. So in our everyday routine task, we do pretty much practice some of these skills, and we may not be consciously aware of the practice, but it would be a good idea. It is a good idea to kind of take time for a minute or two to kind of focus on these basic skills, and it becomes more useful for people with special special problems or issues, or for children and adolescents, or for geriatric patients, geriatric or elderly people with physical or other psychological disabilities. So in a way, this is a good practice both for general public as well as for special populations. Okay. Movement is a universal existential reality to our living experience. The physical world that surrounds us, the ground below, the sky, things that we see around our living existence, the trees, animals, birds, human beings, up in the sky, the sun, the stars, and all the cosmic world that we don't see with the physical world, but with telescopic world, they're all in movement. The living world is moving. So are the microbiota, cellular world within all our living bodies, and the atomic world that permeates everything around us within us are living. All individual and social behaviors and human history, in fact, are all characterized by movements of individuals or groups in the physical and in social space. With our understanding of awareness of movement as a universal existential reality to our living experiences that underlie the physical, biological, individual, and social behavior world at the microatomic and subatomic and cosmic levels of our world, we can then improvise various positions of movement strategies and incorporate the practice to promote our positive well-being. Please note that exercises that I presented should not be viewed as necessarily helping to recover one's functioning, like physical therapy or other medically or professionally recommended exercises do. Rather, it uses one's current level of functioning that is available to the person, and the exercises need to be performed without straining oneself or promoting any experience of pain or discomfort. You may visit my earlier posted video on the rationale I used for linking movement to our existential reality. Please feel free to subscribe to my channel as I plan to post further on topics related to mind stimulation for personal well-being. The ideas I present are drawn from my years of reflections and readings and from my past clinical work experience with various people of all ages as a practicing clinical psychologist, along with my individual and collaborative published work. Please feel free to visit my website psychologymentalhealth.com to view my biography and list of publications.